Hi there, my name is Ewan and I'm going to be going through a few exercises with you today to reduce your low back pain. As always, I would first seek medical advice if you've got low back pain, especially if this pain has been getting worse over a period of time, or if this is neuropathic symptoms like pins and needles, numbness, or pain going down into other limbs. Okay, and it's important to note in these exercises, these are trying to reduce your pain. If you're getting quite bad pain from these exercises, then potentially these aren't the exercises for you. Now, a very common theme with patients with low back pain is that the muscles surrounding their lumbar spine are very tense. And so with these first three exercises that are stretches, I'm going to hope to stretch those muscles and therefore reduce the tension. Okay, so first exercise, if you can see, is we're going to be on our back, and this is called figure 4 exercise, figure 4 stretch, and with one leg we're going to put it across the other knee, and we're going to reach up to the leg which has the foot on the floor, behind the thigh, and pull, and start off slowly, but then you can gradually increase, and you should feel a pull on the leg which is across in the glutes and in the side of the hip. And just hold that for 30 seconds. And if you can't reach your thigh, you can use a belt or a strap just to put round and then pull on it that way. And then swap legs. And again, just holding it for 30 seconds. You should feel a really nice stretch in the glute. And relax. The next stretch is called the cat-cow stretch. Now, if you're going to go on all fours, we're going to put our hands beneath our shoulders and our knees beneath our hips. And then slowly you're going to move into the cat position. So you're arching that spine and you're bringing your pelvis in and bringing your head down. And then you're going to do the opposite movement. So you're going to extend that spine, bring your head up, and bring your hips forward. You should feel a really nice stretch. Now, if this is painful, on the second repetition, I want you to repeat, but not go as far as you did. So it might be the case that there's only really small movements like this, but gradually those movements will increase with time if you continue to do this stretch every day. And the last stretch is the knees bent and bringing your knees out to the side. So we're going to be lying on our back. And if we can try, I can't because I'm on the bed, but if you can put your arms out to the side and relax your chest, that's optimal. And we're just going to bring our knees down to the side, just for a second or two, back up to the middle and on the other side. Nice, slow movement, focusing on your deep breathing in through your nose and out through your mouth. Now, if you can try and keep your lower back on the floor as much as possible, that would be good, because we don't want you lifting up too much, because then you're not perfecting the movement. And 10 to 15 on each side. And when that's done, you can relax. So we've done 3 stretches. Our next exercises are isometric exercises. So isometrics, they are when your muscle contracts but it doesn't move. And it's been researched that they are sometimes good with pain relief. So they might be good for your pain relief. So the first one, a lot of people may know this one, is lying again on your back with your knees bent, hands down by the side, and just elevating the hip into the air, but holding it for about 30 seconds. Nice deep breaths in through your nose and out through your mouth. Keeping those hips up, pointing forwards and your knees pointing upwards. Just holding that. And relax. And we're going to be doing this one twice. So then bring it up again and holding it for another 30 seconds. And relax. I've got one more exercise. I just need to move the camera to get in position. This last exercise is called the supine wall push. And you're going to need a wall, and if you have a mat, that'd be perfect. So you're going to lie on your back, facing away from the wall, put your head away from the wall. You're going to have your hips at 90 degrees and your knees at 90 degrees. And what you're going to do is you're going to gradually push into the wall with your feet until you're pushing quite hard and holding that for 30 seconds. Now, if you're on a slippy floor, you'll probably slip and push away from the wall. If you do have a mat, great. If you don't, use your arms and push them down into the floor, giving you a lot of grip. And in this position, again, working on your breathing, deep breath in and out. And again, relax, shake it off, and repeat again. So pushing into the wall for 30 seconds. Working on your breathing. And relax when you're done. So there was 5 exercises there that you can use to try and minimize your back pain. Again, if you're currently seeing a professional, you can ask them whether these exercises are suitable for you. But these are just 5 general exercises that are quite good for people to reduce their lower back pain as people come out of the pandemic and become more active. All the best, and thank you.